Most dentists aren't trained to run businesses, let alone scale them. This is the TechDental Podcast for dental leaders who want more than just tips. We give you systems, strategies, and straight answers. I'm Dr. Randeep, and each week I sit down with the operators, AI founders, entrepreneurs, and business leaders who are reshaping what's possible in dentistry. If you want a smarter, scalable, future-proof practice, then this is the podcast for you. Welcome back to the TechDental Podcast, the show where we explore how AI and emerging technologies are reshaping the business of dentistry. I'm your host, Dr. Randeep, and today we're diving into a vital area of business operations. My guest today is Rasnaam Singh Tiwana, the founder of Dentstock, a company helping independent dental practices achieve DSO-level efficiency through smarter procurement, automation, and data-driven insights. We'll explore how operational intelligence, not just technology, is becoming the real superpower for growth and resilience in modern dentistry. Rasnaam, welcome to the show.
Hi, thanks for having me on the podcast and for that great introduction as well. Sometimes I forget what we're doing in the grand scheme of things just because we're so focused on the everyday.
Let's talk a little bit about how you launched Dentstock, because you launched this during a period of massive supply chain disruption. How did that experience shape your belief in the importance of data and operational clarity?
So we launched earlier in 2025. So coming out of COVID, practices had often changed their purchasing habits due to the infection control requirements. During that time, prices had fluctuated quite heavily, and the chaos that came out of it was quite clear. Practices purchasing was quite fractured, and in fact, a lot of practices didn't really have clarity on their purchasing. We often, on our calls, ask the question of how much do you currently spend? And I'd say this is a question where often we get a response back of we don't quite know, or it's an estimation, which is fine, but often it comes with a we don't know, but we should know response. And cost control is often key in businesses, but in practice, it's often quite hard to do. For a big practice, you're often giving a person the responsibility of spending sometimes 60, sometimes even 100 or 200,000 pounds per year without the tools, any kind of support, and without any structure to go and spend that 200k a budget. For that person to not have any kind of tools, training, or insights often means they just end up ordering what they have in the past without any real strategy to purchasing. So that's the key findings we have found speaking to practices over the past few years.
And many practices face this dual burden. Many practice owners, they balance clinical care with business performance. How did you design Dentstock to support that balance?
So coming from working in a high-end cosmetic practice, I understood the requirements of clinicians wanting to have their own preferences without interfering in their processes and preferences often on products which do have a significant impact to the clinical outcome as a whole. So we've truly tried to respect that as much as possible. And that is very much tailored to every single practice with the onboarding process we complete. Plenty of principals are trying to run their business as a whole and trying to be in clinic the majority of the week. And that's where often you do need great people and great providers who can try and improve your business as a whole. And for a dental practice especially, you're a small to medium-sized enterprise often, and there's a lot of compliance requirements, HR involved. It's a heavily complicated operation as a whole, and I'd say procurement is an area where often it's undervalued in its impact because it isn't the number one priority that day, that week. Things break, things go wrong. You may have the odd complaint, HR, people being off sick, often those are the priorities, and this kind of purchasing of supplies gets pushed to one side. We understand a why, and that kind of framework of keeping every process to truly be as simple and as quick and easy as possible has been, I'd say, a foundation and a key principle in trying to design a complete end-to-end service for practices to be supported on their purchasing. So that's how we've come up with the concept to truly be quite simple. So from negotiating pricing with suppliers, analyzing your purchasing, and from placing orders in the future, everything is supposed to just be as clean and as simple as possible from the angle of the practice.
Yeah, and it's interesting because I think procurement has traditionally been seen as a back office chore and left till last. Why do you think it's been overlooked as a strategic growth driver for so long? Do you think it's just a mindset thing, a time thing? What's your opinion on that side of things?
I'd say it's been underlooked because it's been challenging to actually understand where your costs are going to. So picking through invoicing is quite time consuming. Often in practice, you won't have anyone in-house who's great at using, for example, tools like Excel to really understand your purchasing. So it's often been very time consuming. Often practices focus on a handful of products when in fact the average practice is purchasing between 300 and 500 unique products throughout a year. That's why I believe it's been overlooked and hasn't been a strategic kind of tool to enhance your practice profitability. Generally, we're able to find people cost savings of between 15 to 25% of their current spend. So generally, that is a significant impact, and often around a 1 to 2% of their turnover being put on their bottom line. So it's very much a easy avenue to go and do that, but the admin required to go and complete that task has been very time consuming, and often practices don't have those expertise or understanding of products and catalogs in that strategic a way of being able to approach their procurement of their clinical supplies and other services.
And I think also with today's climate as well, you've got rising costs, you've got inflation, you've got supply chain volatility. How can predictive data-driven procurement help practices stay resilient without compromising quality or patient care?
So we have a look at a practice's purchasing in full, and there are often areas where the product you purchase may not have an impact on the clinical outcome as a whole. So in changing for example, consumable won't have an impact on the treatment outcome as a whole. And these are areas where the patient won't know the kind of difference in these products. And I'd say that's an area where you can truly control your costs quite well without having any impact. We aren't here to change the products which clinicians enjoy, just because it's time consuming and we respect your opinions as a whole. However, there are plenty of areas where we can find you considerable cost savings, often 40, 50, even 60+% in changing product without it having an impact as a whole on the quality of the outcome. Because at Dentstock as a company are supplier agnostic, we're very transparent. We aren't supplying you anything directly. We work as a GPO, so a group procurement organization supporting practices in their purchasing. We are very much aligned with our customers as a whole. So we believe the customer is the person who pays you. And in our case, it's our customers, the practice. So we're very much aligned. We're trying to save you as much as possible. And it's been a key a requirement. We have a call with a new provider every few weeks, and they're confused as to how we don't take any kind of kickback or commissions. But it means we get to be as transparent with our practices to go, actually, this is the best thing for you. Traditionally, in the US space, GPOs have made commissions and been free to the practices. However, if you're making a few percentage points on a practice's purchasing, you aren't aligned with saving them money as a whole. That's how we get to unlock considerable cost savings for our practices. And it means we get to have very honest conversations with practices as a whole, which I thoroughly enjoy. And often they are surprised in how much we can save them. Just because practices often get told they have great pricing by their current kind of supplier reps, which is understandable. However, we are very transparent in our whole process.
Awesome. And can you, so you work with independent practices as well as groups of practices as well. Can you give an example of how a small data point led to a real big operational shift or real big cost saving as a real world example? Something that really made you think this is why data truly matters and why practice owners should really think carefully about data-driven decision making.
So we took live a practice 2 weeks ago, and when we had a initial conversation, they were very hesitant on change. So we had a look through their purchasing, and we did find some considerable cost savings for them as a whole. And we suggested a change on a product. So we suggested they change their wipes as a whole. They were in fact using the incorrect product on the majority of their surfaces. We did have this kind of conversational point, and they went, yeah, but we like our current ones. So we explained it from a infection control point of view. We then quantified how many they purchased, and it was save them around £1,800 per year. And they were like, okay, then we will change. That practice was only convinced by a great explanation and the cost saving. And that's truly data-driven decision making as a whole. Often we think a few pounds here and there doesn't really matter. And those decisions are often trusted with the person doing the purchasing. And I've been in a similar position before. You're at the supermarket and you go, it's only 20, 30p, but actually you've gone and bought 200-300 of that product across the entire year. That's where we get to unlock practices considerable cost saving, because it's a transparent look at all of their purchases. And we often find there are alarming cases of purchasing certain products, and we help to highlight those to the practice. Often it can go under the radar because that's just how things have always worked in this kind of practice. And we're very keen to always turn this is how it's always been done thinking on its head. And I'm very much a advocate of you can sprint around being very proactive in doing tasks, but actually once in a while you need to stop and have a look at what you are doing. It's the A to Z of a process, but actually start with a why first and go, why are we completing this task, or what are we trying to achieve, and try to look at processes in that lens.
I mean, you mentioned historically it's a time-consuming task. There's a lot of admin, and business owners who are wearing many hats maybe don't have the time to sift through all the data. And we've got AI coming in. How are you using AI as a founder yourself from day-to-day operations and strategy in your own business? And how do you think it can be applied in procurement to reduce this admin burden and really give people that kind of augmented superpower of having AI in their corner. Do you use it personally yourself in your company? And is it something that you see being used more and more in procurement?
We have used AI heavily in our internal processes. For us, it's been an avenue of support. It's been the kind of secondary employee who's a great generalist. And I'd say it's been an advisory tool. It's been very helpful at providing intelligence, cleaning up a data as a whole, but it hasn't been authoritarian for us. We've very much considered it as a helpful tool and just being able to get through work a heck of a lot quicker. I probably use AI once an hour at least in some capacity across all those tools. And I'd say our unique point of view to the market, that has helped us get to market a heck of a lot quicker. I don't think that you would be able to forecast things too well into the future with how AI is currently set, just because practices purchasing does vary a lot per location. You've got clinicians' personal tastes. In that, there are areas where it is easier to forecast, but there is still a great human input required. You wouldn't want to go and trust AI entirely to go and spend 40, 50,000 a year without having some kind of approvals and checks. However, I'm very excited to see what else comes out in terms of trying to support practices in their purchasing, which is AI driven. But I would say it will always be a advisory, a support tool, not there to complete everything, but just to help pull things together for that person to confirm, check, and validate against as a whole.
So that's an interesting take. And I've heard that a lot, where AI really is being used as the kind of advisor or like a co-pilot, but always a human in the loop to push the button and make sure that the decisions are being made in the right context. And with procurement, you do have dentists. They have their favorite materials. They love certain composites. They love the tactile feel of things. So there is that to contend with as well. And I'm interested to get your take on the kind of independent landscape and the corporate landscape, because corporate dentistry has always had the advantage of scale, systems, and centralized purchasing. How does Dentstock help independent practices achieve the same level of operational intelligence without losing their kind of independent touch or without losing that culture within the practice?
100%. So we provide you a service as a whole to manage your costs very effectively. We aren't there to say you have to buy X products. We give our customers as much flexibility as possible. In some cases, corporate dentistry has been more authoritarian in trying to restrict people's purchasing. I'm very much a believer in clinical freedom, and dentists are correct in being selective in their products selection. And we aren't there to cut corners. We're there to improve your pricing, improve your purchasing and selection of products, and speed up the whole process in full. Operationally, we give you tools which cut down the amount of time it takes you to purchase. And that's a great impact as a whole in terms of being able to cut down time spent comparing prices, purchasing good, and then tracking orders as well. People tell me it saves them anywhere from 20 minutes to an hour per order as a whole, plus those cost savings on top. So it's often a win-win. And that's where we really help independent practices and emerging groups just have a great operational process on purchasing and cost control, and just being able to keep the team within a kind of framework. For certain practices, they want their teams to create the order and then it gets approved by the owner or the manager. We can have that in place as well. It's very much tailored to the practice, but I'd say just being able to have a platform which helps you control your costs, understand how much you have spent, are great wins for practices as a whole. And often we just help to show them where they're really overpaying for things. So every so often, I'd say 1 in 10 customers comes to us buying gloves from a provider who charges double the industry average. Gloves are high volume. Everyone has to purchase them. However, if you're paying double the industry average, that's normally a significant area of overspend, normally somewhere to the few hundreds. We as a GPO take you below the industry average price because we've pulled that purchasing power together. In some cases, I've saved singular practices £3,000, £4,000, even £5,000 on just gloves. And that's, I'd say, just one of the 400 products they are purchasing as a whole. That's a case for certain practices, but just being able to have that insight for a practice is handy. And they've often been purchasing that previous glove for years and years. So it very much compounds, and those savings have a massive financial impact to their end of year because that is simply funds they haven't spent. So their profitability increases by that same amount. Those are just some of the few insights we've been able to provide our customers over the past few years. And we've encouraged a alternative glove, which all of our customers have gotten along with exceptionally well. I've been surprised that a singular glove has gone down exceptionally well, just because I know how particular clinicians are on gloves. But that's our kind of insight over a vast number of practices to go. It's actually a great fit for the vast majority of our customers as a whole.
And with the independent owners that you encounter, what are some of the most common misconceptions or fears when they first consider automation or any kind of procurement tech? Are there any kind of barriers that you found just from a fear point of view of having some sort of automation in place? Or is it generally well received once you've explained the USP and you've explained the profitability and cost saving from a business point of view?
There are some practices who are skeptical. They think they have great pricing and that we're not going to be able to improve upon that. And that is totally fair. Like I understand that it does sound like a very good opportunity, but actually, how can we quantify the change? And we're very transparent in our onboarding to compare your current costs prior to joining up. And we often talk about these areas of change, and practices go, are you going to change products I love? And we try and understand each customer in full. We're not here to change products which affect a outcome or affect a piece of equipment. There are plenty of easy wins. However, if you are open to changing some more of your more clinically sensitive products, we do have a lens to try and steer you in the correct direction. And often for practices who've got a big NHS contract, that is often helpful in just trying to understand how they can keep an eye on their costs in a slightly more effective way, just because of the structure of the NHS contract and the financial rewards which the NHS contract is providing. We can just help steer them on the correct path. And because we aren't a supplier ourselves, we're not trying to upsell them or try and steer them towards products for the sake of our own pocket. That transparency often is very handy for practices to go, we didn't consider that in the past, or we had considered it, but we hadn't gone ahead because we only thought it'd be a couple of quid, when actually the quantity they have purchased is 3 times what they thought. And that's been very handy for practices to just have a transparent third party.
Fantastic. And I always like to finish up our conversations with a little lightning round, more for kind of the mindset and the entrepreneurial spirit of a lot of our listeners who are practice owners and founders. I think the first thing that comes to mind here, what's one belief or mental habit that's helped you stay resilient through disruption?
I did have a good think about this earlier today. And the best trait I've had is actually being able to keep calm, understand what's gone wrong and why, and just being able to problem solve on the exact issue rather than getting frustrated or flustered. It's just being able to keep a very calm head, understanding and trying to problem solve what the issue or how this issue's come into existence has been quite key. Being tech savvy-ish is what I call myself. Has helped that. I'm not technical, but I've got a very good technical understanding. Having worked at a health tech startup in the past has helped. And that angle and viewpoint has been very useful in the past few years. It's just being able to keep a calm head. And over the past year with starting up a Dentstock, I'd say just being able to just get my head down and just grind through hours of spreadsheets for customers has been challenging, but I've gotten into a great frame of mind to be able to complete hours of ensuring that we get our customers the best pricing. That mental resilience has been very good, regardless of if I've been in a tired mood or I'm not interested in doing it. I will talk myself into doing it, and I will sit there for a few hours, and I've started to enjoy it. And actually, if I don't do it for a while, I go, I've had that 3-hour period of just ensuring that we've had a look through a practice cost in full. Those two areas I'd say would be my key strengths. I haven't always been the best at those, but it's been a learning point to take on board and try and implement over the past few years, and has been helpful in building something brand new from the ground up.
Awesome. And the second one here, if you lost everything tomorrow but kept your knowledge, what's the first thing that you'd do?
I've always been a big believer in having conversations and trying to learn a little bit about a lot of things. So being a good generalist is quite handy in just trying to understand different parts of healthcare and dentistry over the past few years. There's plenty of cross similarities and differences, but it's the ability of being able to take insights and learnings from other industries, other business interests, other conversations, other personal interests as well. Together, I found has been quite helpful. So just go out there and be a sponge, try and learn something from every single conversation you have. I'd say that would be my go back to square one and begin again process of how to just go out to the world and learn and just be a good person for people to know and be able to make good introductions as a whole. The industry is a small place, and just being able to understand people and their context has been incredibly helpful in just having good, meaningful conversations with industry colleagues, practice staff, and everyone in between as well.
Yeah, I think there's something to be said for being a sponge, and I second that. I think you can learn something valuable from anybody you do meet, and it's always nice to have a broad skill set as well, especially if you had to start something over again. It's nice to know a lot of people and a lot of things. So finally, to complete this sentence, the future belongs to those who
question the why and the how of processes they undertake. I'd say in the past few years, the best innovators and dentists I have met are very much innovative. They try and learn, they try and question we aren't a fan of how it has been done, or we aren't quite a fan of that particular outcome. They go and they develop themselves as clinicians to try and improve the outcome. You can take that same angle and approach with so many areas of dentistry and business as a whole, and it's very intrinsic to, I'd say, where the industry is trying to go to in understanding its figures, trying to have a dashboard and clear insights, how it's always been done isn't how it should be done.
It's been inspiring to hear how Dentstock is redefining operational efficiency and helping practices think more intelligently about the business side of dentistry. For our listeners who'd like to learn more, where can they connect with you and the Dentstock team?
So I'd say we do a discovery call. You can book those on our websites, even if you're just curious on how much we can save you or the process. Do feel free to book a call or connect with me directly on LinkedIn, and we'll be more than happy to have a conversation and just see how much we can save your practice or group on their supply and on other areas of the business.
That brings us to the end of this fascinating and insightful episode. If you want more conversations like this, don't forget to follow, subscribe, and share. It helps more dental leaders discover stories like this one. You can reach us at www.techdental.com or drop us an email at info@techdental.com. I'm Dr. Randeep, and this has been the TechDental Podcast. Scaling a business isn't a dream, it's a decision. This is the TechDental Podcast. And if you found value today, follow, share, and subscribe. This is the edge every dental leader needs.